bucket handle and pump handle. Now is about the bucket handle and pump handle movements of the rib cage, also called as the kinematics, kinematics of the rib cage. Kinematics of the rib cage. So if we before going to this, here we want to discuss 2 points. What is this bucket handle movement and what is this pump handle movement? Pump handle and bucket handle. It's very easy. If we take, imagine if we are having one small bucket here. Suppose the bucket will be having a handle here. Bucket will be having handle here. If we want to carry this bucket, we are just going to lift it to handle. We lift handle like this. We will hold here, then we will carry. So that the movement, how it is happening, that is bucket handle movement. And pump handle also is very easy. Suppose that old days we are having one pump will be there on the floor. So here we will be having this water will come down. So here pump will be there. One person will come and he will do upward and downward movement. So because of that, here water will come down. So the movement what is happening here upward and downward, that is pump handle movement. So now we'll see the axis of motion for the pump handle and bucket handle. Okay. So here if we see axis of motion for this, first we'll see upper ribs and we'll see lower ribs. Suppose if we take upper ribs, imagine this is the body of the thoracic vertebra. So here we'll be having transverse process, spinous process, and transverse process is spinal canal. Okay. So if we take rib, so this is the head of the rib. This is CV joint, costo-vertebral joint. So this is the costo-transverse joint. Then rib cage will come like this. Rib will come like this anteriorly, and here it can articulate with the sternum. So the orientation of the costo-vertebral joint and costo-transverse joint. Here the orientation will be like almost in the frontal axis, frontal plane. This is almost like a frontal plane. What is frontal plane? Frontal plane is going to divide the body into front and back, like anterior and posterior. Usually frontal plane will be like this, anterior, posterior, it will divide. But here the axis what we got through the orientation of the costo-vertebral and costo-transverse joint, it is almost resembles like a frontal plane. So that here the possible movements of the rib cage will happen like upward and forward movements will happen. So that these upward forward movements of the upper ribs are going to create a movement called pump handle. So the movement is pump handle movement. So that here it's clear the orientation of the costo-vertebral and costo-transverse joints at the upper ribs, at the upper portion of the ribs, are in the frontal plane pattern or in the frontal plane. So that the upward forward movements whatever happen in the upper rib cage are going to create the pump handle movement. Okay. Now we'll see lower rib cage. If we come to lower ribs, so here if we take again same is the body of the vertebra. So here we'll be having transverse and spinous transverse process. Okay, this spinal canal. Now if we take head of the rib, and then here this is the costo-vertebral joint, this is costo-transverse joint. Now this rib will come like this. Rib will come here. It can articulate with the sternum. Now if we see the plane of this costo-vertebral and costo-transverse joint in lower rib cage, it's almost like a sagittal plane. If we take sagittal plane, what are the movements of sagittal plane? Flexion and extension. So here if we take sagittal plane like this, it is going to divide the body into right and left portion. Sagittal plane, the almost orientation of this costo-vertebral and costo-transverse joint in lower ribs is like sagittal plane. So that the movements whatever upward and lateral movements will happen in the lower ribs. So that it is going to create a movement called the bucket handle movement. This is about axis and planes of the rib cage. Suppose if we see upper ribs, here will be having upward and forward movement, and lower ribs if we see here we are having upward and lateral movement. So this upward forward movement in upper rib cage is going to happen in the frontal plane, so that it is going to create the pump handle movement. And lower rib cage movements are upward and lower movements in the lower rib cage are upward and lateral movements will happen. So that here the plane is sagittal plane will be there, and the movement is bucket handle movement will happen. Now we'll see very detailedly how bucket handle pump handle movement will happen in the rib cage. Now we'll come to the movement. First one, when ventilation is happening. Okay, when ventilation is happening, the ribs will elevate. So first if we come to upper ribs, in this upper ribs, the elevation of the ribs is going to increase the anterior posterior diameter. It is going to increase the anterior posterior diameter. Suppose as we discussed, so upper ribs because of the orientation of the costo-vertebral and costo-transverse joints around frontal plane, around frontal plane, the upward and forward movements will happen. Upward and forward movements will happen. See here, upward and forward movements will happen, so that it will involve in the pump handle movement, So that here upper ribs. So these are the upper ribs. Here also these are the upper ribs. These are also upper ribs. See here, understand with this diagram, we are seeing a patient in lateral view. This is cervical spine. This is thoracic spine. This is lumbar spine. This is sternum. This is sternum. So the upper ribs which are present here, when we are doing ventilation, ribs will elevate. After this elevation, which movement will happen? Upward and forward movement will happen. See, upward and forward movement will happen, so that the upper ribs are involved in the pump handle movement. So here, this upper ribs, when it elevated upward and forward, they are going to increase the anterior posterior diameter. This is anterior, this posterior. No, they are going to increase the anterior posterior diameter of the rib cage. At the same time, here if we come to lower ribs, after this upper ribs, then lower ribs. So here also the movement will happen in the lower ribs because of the ribs mean elevation, because of the ribs elevation movement. So here the movements will happen upward and lateral movements, so that it is going to increase the transverse diameter of the rib cage, Okay, now we'll see. This is the lower rib cage. Here also this is the lower rib cage. So when the lower rib cage is moving, that time it is going to create a movement like upward and lateral movement, so that when it is moving laterally, it is going to increase the transverse diameter. So the lower ribs are going to increase the transverse diameter of the rib cage. So this movement is nothing but the bucket handle movement, and upper region, upper ribs, lower ribs. So middle portion will be having middle ribs. This middle ribs will be having both upper ribs and lower ribs movements, so that here, what's the point means, when ventilation is happening, upper ribs will involve in the pump handle movement. This pump handle movement is going to increase the anterior posterior diameter. After this second step, lower ribs are going to move like a bucket handle. So these lower ribs are going to increase the transverse diameter of the rib cage. Okay, then we'll come to the sternum. When these upper ribs and lower ribs are moving, the movement of the ribs also, the movement of the ribs is going to create the movement in the sternum. Suppose here, if the sternum is moving, how the sternum can move means upward and forward. So here the possible movement in the sternum is upward forward, same like pump handle. When it is moving upward and forward, and the sternum is moving upward and forward, it is also going to increase the anterior posterior diameter of the rib cage. It is going to increase the anterior posterior diameter of the rib cage. So these are the cycles will happen in the pump handle bucket handle movement. So first upper ribs will move. These upper ribs are going to move in the pump handle direction. Pump handle means anterior posterior diameter of the rib cage will increase. After that, the lower ribs will move. This will move in bucket handle pattern. When this moving in bucket handle pattern, the transverse diameter of the rib cage will increase. So when upper ribs and lower ribs are moving with these ribs, because the ribs are connected to the sternum anteriorly, so that here sternum also will move. How sternum can move? Upward and forward sternum can move. So that here it is also going to increase the anterior posterior diameter of the rib cage. So that sternum here it is going to move like a pump handle. The pattern of movement is pump handle in the sternum. If we come to the 11th and 12th ribs. So here first rib to 10 ribs are having connection to the sternum, but 11 12 ribs but 11 and 12 ribs, suppose if it is T11 and this is T12 whatever. So here 11 rib will be like this, 12 rib will be like this. They don't have connection with the sternum. So that these two ribs are not going to involve in the pump handle bucket handle movements. How other ribs are involving in the ventilation?